Hello, everyone. This is Dr. Trenkle from the Los Angeles Center for Ear, Nose, Throat, and Allergy. We're here today to discuss PCR testing. So we discussed antibody testing a few days ago and went into great detail. What we found is a lot of people had a lot of questions over the different types of what we call PCR testing, which is a testing for active viral DNA. I'd also like to discuss why it's important that we do this types of testing and also debunk any myths and discuss the different types so that people understand why what they're getting and what's the most accurate, et cetera. Okay. So to start, what we're doing with PCR testing is finding active viral DNA, meaning we're looking inside the patient's body, usually their nose or their saliva or oral cavity, and we're getting a swab and trying to find the virus itself. It's really important. This is the most important type of testing because it tells you whether or not you actively have the virus with 100% certainty. Um, so currently, that's the only way for us to know for sure whether people have it, and it's the mainstay of testing uh, across the country. There are a few new tests coming out that they call antigen testing. Those are very, very new. Their sensitivity is a little bit lower, but hopefully those will be rapid and much quicker. Part of the problem with doing what we're doing now is the process can be anywhere between very quick, which is not quite as accurate, to 3 to 4 days of time, turnaround time, which can be a long time to wait. So let's kind of go through each type of test to start. The first type of testing that we're going to discuss is something called nasopharyngeal swab. This is what is the mainstay of testing right now. We still consider it the gold standard, okay? And the problem with it, as you can see from this diagram, is that it's very challenging. So what we're trying to do is get back to what's called the nasopharynx. The nasopharynx is the back of the nose, right back here, okay? The pharynx is basically this whole area here. So we break that into the nasopharynx and the oropharynx, okay? And then down here into the larynx and hypopharynx, which we won't need to talk about in this video. So what this is demonstrating is how far back a nasal swab has to get. This really is not super fun to have done, but it's where we consider there still to be the most active amount of virus in the body. So what oftentimes happens is people will take these swabs thinking they're going to the nasopharynx, and if they're not trained well, they go up in this direction into the middle meatus and hit kind of the turbinates. Now, that's okay. There have been some studies that have shown nasal swabs to be just as accurate as nasopharyngeal, but realistically, we really would like to get all the way back to the nasopharynx. There are a few things that can get in the way. If you have a deviated septum and large turbinates, congestion, and just in general, it doesn't feel good. The swab going all the way back is rubbing up against the turbinate and the septum the whole time, so it doesn't always feel great. But the important part of this diagram is to kind of illustrate that not just anyone can go back and do a nasopharyngeal swab. They really need to be well trained, and that's kind of what we look at as ENT doctors because we're constantly back there. Also, there have been some complications. I think we posted a video on our Instagram of someone going to a free testing site and getting the swab broken off and stuck in their nose. So those are also things to worry about. Another type of testing that we see very commonly is called oropharyngeal swabbing, okay? And that is basically a strep test is what most people think of. So here's kind of a diagram that illustrates this. And what we're trying to do is get back to the oropharynx, which is usually the tonsils in the back of the throat here, and take a swab. Now, the problem with oropharyngeal swabbing is a little less accurate. There's usually less viral shedding happening here. And also, it does create a gag reflex or a cough. And that gag reflex and cough can lead to more viral shedding and spewing out. Okay, so we try to avoid that as well. There's a very new type of test that they're calling bronchoalveolar lavage fluid. So BAL is also a very common and gold standard way of collecting it, but you usually need to get into the lungs and get what we call alveolar liquid or lavage out in order to find the virus there, which is not easy to do unless you're doing a procedure. So very interesting. There's a lab here in California called Corva that partnered with a private equity firm, and they were actually to get validated something they call BALF, which is getting alveolar lavage fluid. So what they have the patient do in their drive-through is they have them kind of cough really heavily as hard as they can into their, get their mucus from their chest up into their mouth. And then they use a big swab, shown here, in order to try and rub that fluid from their cheeks, the roof of their mouth, their tongue, kind of all sorts of areas to try and get a combination of saliva as well as the bronchoalveolar lavage fluid onto the swab and then put it in. So The only issue with this is that the study they did was very limited. It hasn't been published yet. About 45 patients, but they were validated and they got the EUA through the um, through the FDA. And time will tell with all of these what's the most accurate. We just don't really know. I mean, this could be more accurate, could be less accurate. We're not 100% sure. So a lot of the testing sites are utilizing this on what's called a TACPath machine, which is what the machine that's just reading it. So the last one we'll discuss is salivary. So salivary fluid, just spitting into a cup, is something that we've seen before from companies such as 23andMe. This is a picture of just that. This is not the one that we currently use. I'll show you that in a second. But when you're doing salivary, basically what you're doing is you're spitting into this funnel. It's going into this big fill line, and then we're attaching what's called an RNA buffer to stabilize the salivary medium, and then they are testing that. This is what we feel is going to be the most accurate overall. It's just there's only one lab in the country currently that's able to accomplish this with their specific EUA, and probably more are coming. This is kind of the spec sheet that we use for that. And so it kind of shows you the steps. Basically, you're filling up this line, we attach this little thing, and then we shake it up, essentially, and then we ship it to the lab. So those are all the different types of testing, and the main questions that we are often getting are, well, which one's the most accurate? And I don't think that's a very easy one to answer. I think the safest thing is nasopharyngeal swab overall, because nasopharyngeal swab we do know to be the most consistent in terms of how long it's been being used and for different types of viruses. So currently that's what we try to do. It's also pretty quick turnaround time. We also have saliva PCR that we allow. There are some limitations to that, which include mostly the shipping time and return for the lab, but that's also has been very, very accurate. I think at the end of the day, the important part is that it all comes down to the user and the administrator of the test. So you just have to be careful of really where you're going, because if they don't know exactly how to do it, it might not be done accurately, and you could get what we call a false negative, meaning a negative test that should have been positive. It's really important to be utilizing these tests smartly, and that's kind of where we come in. We try to do consultations. Well, we do consultations for every patient because we want people to understand what they're getting out of these tests, also with the results, to understand not just is it positive or negative, but what does that mean for you? What should you do with those results? How can you utilize them for back to work, etc. So that's pretty much it for today. I hope that was informative. And if you have any questions, feel free to get in touch with us.